On FM, AM, online and digital radio.
This is Nesta McGregor.
On BBC Three Counties Radio.
Right, so it's just coming up to 8:15. Now, a Hertfordshire-based fertility clinic is calling on more black women to donate eggs. Black as well as Asian patients are having to wait far longer for IVF treatment because of a shortage of donors. Now, David Agotu is a fertility specialist at the Herts and Essex Fertility Centre and should be on the line now. Good evening, David. How are you?
Good evening. Are
you well?
Yes, I'm well, thank you.
Good, and we can hear you loud and clear, so that's all great. Okay, well, I'm going to put as much expertise as I know on this subject. To reproduce, you need an egg and a sperm, correct?
Yeah, you're right, yeah.
And the rest is up to you. I mean, so for people that's not familiar with IVF and egg donation, can you just tell us, in simple terms, if possible, the process?
Yeah, I mean, the main reason why people need donor eggs is some women may have lost their ovaries either through surgery, through ovarian cancer, or a premature menopause, or older women who may be running out of eggs would need eggs of a younger woman for conception purposes. And the egg donors would have injections to stimulate the egg that they would have ovulated from that month, as well as a few others that would have gone to waste that month, get followed up by ultrasound scan, and over a 10 to 14-day period, I would go through a surgical procedure using needles to collect the eggs under ultrasound guidance. Okay, and is there any reason for the shortage? There is traditionally been a long waiting list for donor eggs in the UK, and that's for all patient groups. But for the last few years, we especially at Heart and Essex Fertility Centre going through a phase where we don't have a shortage of Caucasian egg donors. There's more and more Caucasian egg donors coming through, which means we have no waiting list for Caucasian egg donors. Okay. We're seeing we're seeing an increase in black and Asian egg donors coming through as well, but the numbers are not big enough to meet the demand, so much longer wait. I mean, we mentioned it's black and Asian patients. Might this be down to sort of religious beliefs as well, do you think? It's difficult to tell for sure. I mean, there's more Caucasian in our area, so there's probably going to be more Caucasian egg donors. But for ethnic minorities, it could be cultural, it could be religious reasons, or just not something that they're very familiar with. So we thought that by raising awareness of this, we hopefully would get more egg donors coming through and lower the waiting list for these patient groups. Yeah, and being from the black community myself, David, I can't ever remember hearing sort of one conversation, maybe my entire life, about IVF or, egg donation, around my family and friends. Yeah. So might people be scared of what the process actually involves and what they have to do? It could be that, or just not aware of it. There's always this misconception that by donating eggs, you lower your egg reserve and lower your chances of getting pregnant later on in life. But what happens is women are born with a set number of eggs. They've got several 100,000 or millions of eggs in reserve. Every month, 10 to 20, 30 are recruited. She would ovulate from one, and 19 would go to waste. In an egg donation program, she would donate the one she had ovulated from, and the rest that would have gone to waste anyway. So we're not lowering her egg reserve, yes. Yeah, and I mean, the waiting time, how long then can someone be waiting? How long have you had people on the list waiting for an egg? It used to be up to a year or 2 years. We're down to, for black and Asian egg donors, we're down to about 6 to 8 months wait, whereas for Caucasian recipients, there isn't a waiting list. So the demand is increasing, and so we're trying to recruit more ethnic minority donors for this reason. Okay, and excuse my stupidity, you could probably tell I didn't pay attention in science or biology. Is a woman's egg an egg? I know it's made up of sort of, half of their DNA, etc., but if you didn't care what colour your child would be, could you use an egg from a Caucasian donor and put it in a black woman? Yes, so, it's all human eggs, so whichever race it comes through, you still get a chance of success. But of course, most people would want to have a child of similar characteristics. So black women or Asian women would be looking for black or Asian egg donors. But we've got a few cases whereby, especially in mixed race couples, where they've used eggs from a different race and it works just as well.
And is there a reason, if there's a shortage at your clinic, you can't get them internationally, or from parts of the world where there might be a large number of black and Asian women donating them?
The fertility treatment is very highly regulated, for obvious reasons. So it's not possible to import donor eggs. It's not easy to import donor eggs, and for you to import eggs, they would have to have been produced, frozen, and then imported into the country. The regulations make it difficult to import from outside Europe, but also frozen eggs don't work as well as fresh eggs. So the success rates with frozen eggs aren't as good as with fresh eggs. So
I understand, David. And just before we leave you, in a second, we're going to speak to someone who has donated an egg. But I mean, what incentive is it for someone to come forward? Apart from it's a massive incentive, helping someone have a family.
Yes. So in the UK, we're not allowed to pay for anyone's eggs. So women cannot sell eggs for as such. The main source of our donor eggs is through something called an egg share program. So these are young women who say, for example, her husband's sperm is weak, meaning that they need IVF treatment, would be able to have the treatment for free in exchange for treatment for free, use half the eggs for her treatment, donate the other half anonymously, and they get free treatment for that way. But we also have women who donate eggs altruistically, which means donating eggs to help someone out there. They cannot be paid, but the maximum compensation we're allowed to give is up to £750 for time off work and things like that. So it isn't financially rewarding as such, but there is compensation for it. Yeah,
and similar with, I guess, a sperm donor then, obviously it's all done anonymously, but when the child reaches 18, they do have a right to find out who their biological parents are. Is it the same with an egg donation then?
It is exactly the same,
okay.
Yes. Another the donors also have got to be screened for inheritable genetic conditions or infections. So there's a screening process to make sure that to minimize the chance of a condition being transmitted to a child. Yes.
Okay, and so finally, David, thank you for joining us, by the way. But if people are interested then, or just want to kind of find out more, probably a lot of scaremongering, if they do want to know about the process, the kind of health, restrictions or blah, 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 where can they find that out?
There is lots of information on the Human Fertilization and Embryology Authority website, the HFEA, which regulates all fertility treatments in the UK. But we would encourage them to give us a call. We have would be able to see them for consultation at no charge and discuss the process in detail with them, give them as much information as they need, and take it out from there.
Listen, thank you very much for joining us this evening. That was David Ogotu, who is a fertility specialist at the Hearts and Essex Fertility Centre.